Vietnamese News, the longest running Vietnamese language newspaper in our region. Go to nvnorthwest.com.
Kind of nonsense conversation are we having here?
The Neon Ghost Show. The Neon Ghost Show. Right here on Rainier... what's it? Rainier Avenue Radio.world.
Right about now.
Rainier Avenue Radio.world. I'm so tired. I have to pee.
Hello, listener. What's important to you about what's going on in your community? Are you interested? Are you concerned? In any case, I invite you to tune into my show, Seattle Here and Now, on Rainier Avenue Radio.world. Why? I will be covering a wide range of topics important to you and impacting the community. Each show will have a special guest or guests to share with you information on a variety of subjects that are happening here and now in Seattle. I promise I will work hard to make my show informative, interesting, and entertaining. Be sure to listen to Seattle Here and Now on Rainier Avenue Radio.world.
Friends of Waterfront Seattle presents Pier Sounds, an October concert series at Pier 62 on the downtown Seattle waterfront, featuring sensational regional bands and artists, including Tiffany Wilson on October 16th. These free, family-friendly concerts welcome everyone to come and enjoy live music and the sights and sounds of Seattle's waterfront. Pier 62 was home to one of the most iconic and popular music events in the city, Summer Nights on the Pier. Pier Sounds concert series forges this memory with new energy and music on a revitalized Pier 62 to reignite the sense of celebration and community in the place where it all began. Pier Sounds' new concert series at Pier 62.
Visit peersounds.org for free tickets and more info.
Rainier Avenue Radio.world is your 24/7 digital media hub. Tune in at Rainier Avenue Radio.world. Also find us on Facebook, Twitter, and TuneIn apps.
Welcome to Rainier Avenue Radio.world. Rainier Avenue Radio.world presents this special programming every Friday, the impacts of the coronavirus on South Seattle and surrounding communities. It's me, Tony B, and we have a very informative show for you this afternoon. You look at the pandemic, and a lot of the information that we get is local, which is, of course, what we need to have with our communities. And we strive to make sure that we give our communities the information that they need and how this is impacting locally. Then there's also, of course, Washington State regionally, how things are impacting. Then there's nationally what's going on with the pandemic in the various geographies around the country. There's another part of this, though. It's global. We don't often hear much about how the coronavirus is impacting globally. Well, there is a thing that some of the poor nations that struggle for access to shots, and they're calling it vaccine nationalism. Essentially, the poorer nations don't have enough vaccine. 75 countries around the world call for an end to what they describe as vaccine nationalism. And they did this in a joint letter to the United Nations this month, and demanded that COVID-19 vaccines be treated as a global public good for health, arguing that richer countries should not be allowed to stockpile their resources while poor countries go without. A lot of folks are saying that the answer here is that the only solution really is global solidarity. And the concept of vaccine nationalism refers to the signed agreements a number of countries made with the vaccine manufacturers before the shots became available to the general public, allowing them to buy up large amounts of the vaccine, which in turn makes the initial supply of vaccines unaffordable and inaccessible to poorer countries. And more than 18 months into the pandemic, while some wealthy nations appear headed toward pre-pandemic normals, many cash-strapped countries remain ravaged for resources. I'd like to welcome Dr. Ali Madad to the conversation, and I want to make sure I'm saying the name correctly. Dr. Madad, are you? Am I saying your last name correctly?
Mock Dad, yes. Thank you for
Mock
having
Dad.
me, Tony.
Well, thank you for being here. And I've with your resume, you've got a pretty lengthy resume, which qualifies you to be on top of this. And I can read it, but I would rather have you do it. Why don't you tell our listeners and viewers a little bit about your background, Dr. Mokdad?
I was born and raised in Lebanon, and I came here for higher education. I worked at CDC for a long time, doing surveillance, outbreak investigation, emergency and response at CDC. And I have joined the University of Washington 14 years ago to work on the Institute for Health Metric and Evaluation. But the most important part, Tony, I'm a father and a husband.
I completely agree. I don't know if you had an opportunity to hear my monologue beforehand talking about, again, what's becoming known as vaccine nationalism. And I do want you to comment on that. But first, maybe you can set the stage for us. And correct me if I'm wrong here. Does what happens with the pandemic outside of this country globally impact this country, potentially even our local communities? Even though it's we have our own issues within this country globally, what is the potential impact if nations that are poor, that do not have access to the vaccine, how does that impact the rest of the world, or does it?
I heard your monologue, and you've done a very good job summarizing the issue. It's not only about COVID-19. Anything that happens in another part of the world will impact us one way or another. At CDC, even before the pandemic, we had something called the global disease detection. To protect us here in the United States, you need to catch a disease elsewhere as soon as possible before it gets on a plane and it arrives to the United States. So it's to our own advantage to help other countries to be able to detect a disease, a virus, a bacteria, stop it at the source, deal with it, because it has a huge return on our investment here in the United States. Come to COVID-19 right now, we need to remind everybody who's listening that the virus came from other countries to the US. It wasn't a homegrown virus. New variants that are arriving, some of them are homegrown, but some of them came from other countries. So we're not safe until all of us are safe. And this virus, many people lost a lot. Many people lost their lives. But we shouldn't lose our humanity. We should help each other to overcome this pandemic.
65% of the population of high-income countries had received at least one vaccine shot as of September 9th, while just 2% of the population of low-income countries had received at least one dose. This is a data from the Kaiser Family Foundation. I know that for you, the politics of this are not as important as the health concerns, but how do you explain this? 65% of populations of high-income countries, 2% of the population of low-income countries, and we knew early on that this was a global pandemic that didn't come from this. How do you explain this? Can you share with us why this is taking place?
Many countries are only considering themselves and then paying attention to what's happening within their own borders. And they went ahead and bought the vaccines, some of them at risk. They didn't know if a vaccine will work or not. But they bought a vaccine at risk, and they bought much more than what they need. So basically, they took it away from poor countries because poor countries do not have the means to buy at risk a vaccine, knowing it may work or it may not work. And the politics of the rich countries, because they can go to a vaccine manufacturer or a drug company and say, hey, if you don't sell us the vaccine first, we will not buy for any of your products. And we have to admit it, we are the biggest market when it comes to pharma. All the rich countries are the biggest market. So it's a monopoly in a way, and the big countries, powerful countries, are buying more vaccine than what they need. But that's, in my opinion, there is even more of a danger here. If you look at what's happening here in the United States, we're buying vaccine and sitting on it, waiting for people to change their mind and come and get the vaccine. Where in other countries in the world, as you mentioned, Tony, people are waiting in line and they're dying waiting in line to get the vaccine. That's not acceptable.
Wow. Again, you're listening to Tony B. This is Rainier Avenue Radio. My guest is Dr. Ali Maqdad. We are talking about, well, what's become known as vaccine nationalism. Poor countries don't have the vaccine. Wealthier countries not only have the vaccine, they have stockpiles, and I don't want to say more than we need, but the poor countries, I think 2% had one shot as of September 9th. Now, my understanding, Dr. Maqdad, was when this all began, there was an effort to make sure that the vaccine would be available to everyone because we knew that it has no borders. And again, this is kind of getting into the politics of it, but I guess it was Moderna. It was like, no, we're selling our stuff and we're selling it to the folks who have the most money. Where does the World Health Organization fit into this? Is there a way to come to a resolution regarding global public health?
The WHO, World Health Organization, is doing an amazing job trying to secure vaccines for every country in the world. And many countries, majority of them were poor countries, worked together with WHO on something called COVAX in order to ensure everybody gets the vaccine. But the reality is people who have the money are more likely to go and get the vaccine. And the sad part, as you said, that you have mentioned, not we have more vaccines than what we need right now or ordered more than what we need. We're wasting vaccines. In many countries, rich countries, we are wasting vaccines. In the United States, the latest information, and I tweeted and talked about it in media, we wasted 15 million doses. 15 million, I started telling you I was born and raised in Lebanon, would vaccinate the population of Lebanon twice.
Again, my guest, Dr. Ali Maqdad, you mentioned COVAX, which was formed in 2020 as a way for high-income countries and corporations to pay for vaccine access to the 92 poorest countries. And the program initially appeared to run smoothly as vaccine distributions began in late February, with almost every country in the world signing up. But as the months went on, supply chains slowed, and COVAX could not financially compete with the richer countries that were buying up the market share. Let's go back and can you start with explaining what COVAX is and how it was formed and why it came to be?
It was an effort by WHO and many countries and many public health, population health professionals to tell the world that, we're not out of danger until everybody is out of danger. And we need to buy vaccines for other countries. And we need to make sure we allocate equitably the vaccines that are available. And also, Tony, let me add, it's not only vaccine. We know right now that mRNA vaccines are doing much better than the rest of the vaccines. And we know right now that mixing and matching, if you get one vaccine and you get an mRNA after that, you'll increase your immunity. So we need not only vaccine, we need good vaccines. And we need to help countries to produce them. Unfortunately, the COVAX and WHO efforts have not been able to generate or raise the funds that are required to secure vaccines. So even during a pandemic, rich countries are not willing to pay for poor countries to get the vaccine. And I would like to add, as a professional, population health professional who've been in many countries working on emergency and other related issues, that it's not only giving them a vaccine. Remember, when we started vaccinating in the United States, we had so many hiccups. You need to help countries to be able to administer the vaccine. You need to help countries to be able to have the logistics to deliver the vaccine. The cadre of professionals who can vaccinate their population. We have a lot of work to do ahead, and we need to help other countries to be safe.
Dr. Maqdad, I know you don't have a crystal ball, but y'all do due diligence and research on these issues to try and get ahead of what's happening. What does it mean? What happens when there is unequal vaccine allocation globally?
When you don't have enough people vaccinated globally, when you don't reach a herd immunity globally, what will happen is that virus is still circulating in many places. And what viruses do, and they do very good, is they mutate and they try to protect themselves. They want to survive. They try to protect themselves from the immune system that is really attacking them. So basically, you're giving the virus a chance to mutate and come up with a new variant that makes the vaccines that we have used in the United States less effective. Remember, we started these vaccines here in the US, Pfizer, Moderna, 94-95% effectiveness. With Delta variant, the effectiveness went down. So we need to remind everybody in the world that unless everybody else is protected, and especially rich country, people in rich country, that it's to your own benefit to vaccinate the world. It's to your own benefit to vaccinate the world. And what you're looking right now globally, because of the slow administration of the vaccine due to availability of the vaccine, we're looking about having 50-60% of the globe still susceptible to the virus, which will contain a surge or will support a surge, and then will support a production of a new variant. We can't afford that. None of us can afford that.
So I'm just going to, tell me like I'm in the 6th grade. So in Washington State, we're looking to 70% and to create what we've heard is called herd immunity for our state. But the rest of the country, if even in the United States, the rest of the country, some of the states are not reaching that mark, that will impact us here in South Seattle potentially.
Of course. If you look at, again, we're not picking on any state, but if you look at what's happening in Alabama and many other states here where vaccination coverage is very low. Remember, the United States population, we're a mobile population. We move around from one place to another. We're having holidays coming up. And if people are not vaccinated in many parts, especially in rural communities in the United States, it means they could get infected and they could spread the virus to places where we have high coverage. We're not safe in South Seattle if in the east part of Washington State, we have a low vaccination coverage because people could be infected there. They will interact with us here in King County. And yes, they will end up in our hospitals here at UW because we have the capacity to take patients from everywhere. And it will impact all of us.
And I know we just talked about this, but by the same token, okay, that's our country. We take care of the folks in our country. We get everybody vaccinated in our country. We have borders. How does the potential of an unvaccinated global population impact us as a country if we've done our job as a country? And again, there's a lot of hesitancy about taking the vaccine. There's anti-vax groups, but if somehow we manage to do this, and Dr. Magdad, I think you know why I'm bringing this up, because we are hyper focused on what we are doing here locally. But even if we do our best locally in this country, we're still going to be susceptible, is that correct, to the Delta or to COVID and the various variants from around the world in the poor countries or wherever it happens to be?
Of course. When you say pandemic, it's global, it's not a country specific. And again, the approach to deal with a pandemic has to be global. Let's look at our history. Spanish flu, we shouldn't use the word Spanish, but the flu pandemic that happened in 1918. There was deaths in the Samoa Island from what we know right now, H1N1 flu. Even at that time in 1918, 1919, where we didn't have as much travel and people were not moving around. Right now, we have more people moving around. We have travel. We have a supply for merchandise. We have one of the biggest ports here in the region, in Seattle and Tacoma. We have people coming in. We have companies that we invite people to come, and because of business, Microsoft, Amazon, you name it. So even if we are 100% here protected, unless we take care of everybody else in the world, and I know it's a big task, but that's the right and humane task. But the most important, That's to our advantage, and that's to protect ourselves here in King County, in my neighborhood, in your neighborhood. We are only protected if everybody in the world is protected, and we take care of this virus and it's not circulating anymore.
Are there instances recently that you can point to that show, as a global community, we are making progress, or we have made progress in this area of understanding, again, pandemics, global viruses? Have we made any progress in that area?
Unfortunately not. I wish, Tony, I could tell you yes. We in the public health business have been warning everybody about the pandemics. We're saying, it's not when it will come. It's for sure it's coming. We knew that. And people were denying all of this. We're not prepared. And the most important part, we're not talking about it. And you started in your monologue saying that we had cracks in our health system. We had disparities in our country. And that's why we were impacted more than anybody else with all our resources by COVID-19. And then it's time for all of us in the US, as we rebuild right now, and we're putting money into our economy, to make sure we do it right and we don't leave anybody behind. Same apply globally. Let's do it right and don't leave anybody behind.
You're listening to Rainier Avenue Radio .world. Is me, Tony B. This is our special program, Impacts of the Coronavirus on South Seattle and Surrounding Communities. Again, we started doing this on March 20th, or excuse me, in March of 2020. I think the 13th was our first show. It is now October 15th, 2021. And we're in the same position, if not a worse position. Dr. Mogdad, again, what do you see when you look at how this is going to impact us globally in the future? And I'm not, trying to put you in the position of being a harbinger of bad news, or maybe the person who says everything is all right. Just from your professional perspective, where we are now, October 15th, 2021, what lies ahead in regards to us being able to, I'm going to just use this word, and for some people, they don't want to go back to normal, but I'm going to say something that we were used to before the pandemic?
What you're looking at right now, that in the United States and in the Northern Hemisphere, in even Western Europe, we will see a surge in winter simply because this virus is seasonal. And then on the long-term projections, we will be in a much better position with vaccines in the US and boosters right now come spring for us. But the rest of the world, no. We will see a rise in cases in many parts of the world. If you look at countries, for example, in Africa, Nigeria, Egypt, India, Pakistan, vaccination levels are very low. And then you will see a surge simply because there are many people who are susceptible. And let's remind the people who are listening to us, right now here in the United States, everybody is talking about supply chain. There is a delay of food arriving, delay of goods arriving because of the pandemic is impacting the globe. And the solution, again and again, Tony, has to be global. And we have to help each other. We have to be a community. It's keep an eye on, or say it's similar to climate change. The climate is going to impact everybody in the world. Nobody is going to be immune and say, well, this global warming and this change is not impacting me or impacting my production of food or my prosperity. Same with the pandemic, is impacting all of us, and the solution has to be global. It cannot be local.
Dr. Mogdad, I want to get final words from you, but before we do, I just want to make sure that we're all on the same page here, because we're hearing now about mutations and variants of. So, can you explain to us what a variant or mutations are? Are they one and the same?
Yes, a mutation is the virus will change its shape or its form, and then that's a not a new virus, same virus, but it has mutated. The variant is what we call that mutation. So the variant is Delta. So it's a mutation that happened to the virus compared to the previous variant that was available, but it produced that mutation, produced a new, not a new virus, a different looking virus that we give it a name, a variant that has caused that right now, and it's circulating right now.
Dr. Magdad, thank you for coming on and having this conversation with us. We don't have a lot of conversations about the impact globally and how that can impact us regionally as a nation and right here in our own communities. I'd like to give you the space here to share with our audiences whatever you want, whether it's a global message, a local message, just where we're at, whatever you would like to share right now with our audiences about where we're at. The floor is yours.
Tony, I would like to thank you first about this topic. You're reminding all of us that we are so interconnected and we're human first, and we need to take care of each other. I'd like to end by saying here in Seattle, I have published and I have shown before that we have about 15 years gap in life expectancy between different census blocks within the King County. We have a lot of disparities in our own community we need to address. We have a lot of issues that we need to take care of here, especially now with COVID-19. It hit our minorities harder. We know that African American were more likely to die, Hispanic, Native American, from the virus, simply because we failed to protect our essential workers. We need to do a better job here at home front, take care of our own. At the same time, to protect ourselves, we need to take care of everybody else in the world, and we have a responsibility. We have the means and the know-how, and we have the resources to do it. Thank you.
Dr. Ali Magdad is a professional of health metric sciences at the Institute of Health Metrics and Evaluation, IHME, and Chief Strategy Officer for Population Health at the University of Washington. The Population Health Initiative was launched by President Anna Marie Koch to create a shared vision for improving the health and well-being of populations locally and around the world. Dr. Magdad, as a public health researcher, you've published groundbreaking work. You mentioned a little bit about that on the local level, disease trends and some of the leading risk factors for poor health. And your work on obesity is among the most highly cited in the field. As Director of Middle Eastern Initiatives for IHME, you've built the presence in the Middle East through new research projects, dissemination and uptake of IHME's methods and results. So, that's a lot, and you are one of those people who folks may not hear of, but this is also an opportunity to shine the light on the work that you do and your peers do on behalf of our community. So thanks again for joining me.
Thank you.
You're listening to Rainier Avenue Radio.world. Coming up, we're going to be talking about rent assistance, evictions, assistance for you that's out there. And we'll be talking to Hedda Mc... my last name. I'll get that. And we'll come right back right after this.
This is Paul Pearson, host of Star Time. And when I'm not driving my sweet AMC Pacer through the car wash, I'm listening to Rainier Avenue Radio.world. You missed a spot.
High school football is back, but guess what? We need more referees. There's a constant need for qualified individuals to work our high school football game. Please consider becoming a football official. Go to pnfoa.com and sign up today. That's pnfoa.com and sign up today. This is a message brought to you by Rainier Avenue Radio.world, your home for Metro High School football.
What's on your heart? Are you exhausted at the lack of progress for people of color in business, politics, and life? This is Cindy Bright, the host of Heartbeat Radio. Each week, we explore this heart condition in the country that is affecting you and me. We have real conversations about what's necessary for change. Time to change this dialogue. Will you join this Heartbeat weekly, Wednesdays at 7 p.m. on Rainier Avenue Radio?
This is your Rainier Avenue Radio.world community update on online Alcoholics Anonymous meetings. If you're looking for an AA meeting, find one every day online at aaphonemeetings.org. That's aaphonemeetings.org.
All lovers, check out the Quiet Storm Dedication Show with Sergio LaCour on Love Lines. Thursdays, 9 p.m. Pacific on Rainier Avenue Radio.world.
I love the music.
Rainier Avenue Radio presents the Community Election Connection Debates, powered by Converge Media, powered by the South Seattle Emerald. Rainier Avenue Radio will be hosting a series of debates. You'll hear from both candidates. You'll hear pro and con voices. We are requesting your participation. Rainier Avenue Radio presents the opportunity for you to hear directly from candidates about issues and concerns related to your interests. Rainier Avenue Radio provides an opportunity for the candidates to secure your vote. It's your vote, and your vote matters. What's important to you? These debates will cover a combination of topics in response to issues deemed important by our communities and specific issues that impact South Seattle residents. You have the opportunity to submit questions for the moderators. Moderators will include Rainier Avenue Radio on-air personalities, community members, people just like you, business leaders, local media, and local journalists. Watch live on Rainier Avenue Radio.world.
This is Rainier Avenue Radio.world.
Welcome back to Rainier Avenue Radio.world. If you are just tuning in to our special broadcast of the impacts of the coronavirus on South Seattle and surrounding communities, you just missed a conversation with Dr. Magdad where we were talking about what's known as vaccine nationalism. At the end of the day, what that means is that poorer countries have less vaccine because wealthier companies were able to purchase the vaccine and then stockpile the vaccine. Not everyone wants the vaccine, so there's vaccine just sitting. There was something called Covert that was supposed to ensure that poorer countries also had access to the vaccine. In particular, it was Moderna, and it just is what it is. That was saying, oh, you know what, we're going to sell our vaccine to the highest bidder. And that being the case, the wealthier countries, of course, got lots of vaccine, enough to populate, enough for their populations. I don't want to say, more than is needed because everyone is still not vaccinated, but everyone doesn't want to be vaccinated. And so what do you do with the stockpile? What happens with that particular stockpile? Anyway, if you missed that, you can go back and listen to it or watch on our YouTube channel, on our Facebook channel, on our Twitch channel. We'll have that uploaded on our archive, so you can just listen with Rainier Avenue Radio .world in a few days. But again, we've been talking a lot about local. We've been talking about regional, even national. And so if you missed that conversation on the impact of global inequities when it comes to availability of the vaccine and how it's going to impact you even in the community that you live in, go back and take a listen to that show. Coming up right now, joining me, I'd like to welcome to the program Hedda McLinden. Hedda, how are you?
Hey, Tony. Thanks for having me on Rainier Avenue Radio. Pleasure to be here. I'm doing well. How about you?
Under the circumstances, Hedda, I'm fantastic. Under the circumstances. And the opportunity to have this conversation with Dr. Magdad is an example of why I say that, because everybody ain't doing so well, and some people are doing horrible during this pandemic. As a matter of fact, I spoke to an acquaintance not too long ago who lost his mother, father, and sister.
Wow.
To COVID.
Wow. It's a tough time for our community, isn't it, Tony?
Yeah. Well, Hedda, you are the director of the COVID Emergency Service Group at King County's Department of Community and Human Services. During the pandemic, you've been leading the county's mass vaccination centers, plus isolation, quarantine, assessment, and recovery. shelter de-intensification facilities. I don't know what that is, but I guess we'll find out. And since joining the Eviction Prevention and Rent Assistance Program, you've been making significant changes and updates to the program's application process, easier to get rent payments out faster. So let's back up and start with this. The Eviction Prevention and Rent Assistance Program, what is it?
Yeah, thanks, Tony. Thanks again for having me. The Eviction Prevention and Rent Assistance Program is an opportunity for community members that are behind on their rent payments, behind on their utility payments that are part of the lease, to actually get those payments paid. There's a potential to pay 9 months in back rent or rent arrears, and also 3 months in future rents to really try to stabilize that individual, that family, and give them an opportunity to get on their feet and focus on some other things rather than needing to pay the rent to the landlord.
Okay, sounds good. Sounds good. Let's start off with this. Who is eligible
Sure.
for the Eviction Prevention and Rent Assistance Program? And that's two different things: eviction prevention and rental assistance. We'll come back to that. But who's eligible?
Yeah. So, who is eligible for the rental assistance program is any individual or family in King County that has been impacted financially by COVID, is housing instability, and meets the area medium income of less than 50%. So the number of people in their household, we look at all their income, and that is who is eligible for this. We have designed this program really intentionally, Tony, to try to serve our community members that have a long history, even before this pandemic, of systematic racism. They have had less access to opportunities to gain money. They have had less access to housing, and therefore they are really impacted these days by COVID, by the financial downturn, by the economic and educational impacts COVID is having and this pandemic is having. And we are really trying to focus on that community, on your community, Tony, and getting rental assistance dollars into individual and families' hands to really prevent an episode of homelessness and really help people contribute to their communities and being thriving members of their community.
Give me a bigger explanation, if you can, or a more clear explanation for me on that 50% of household income. Can you kind of elaborate?
Yeah, sure. Give you a sense of how much that is. Let me pull that up so I can give you some exact numbers. So the way it works, Tony, is we gather information from households about how many people live there, how many people over 18, and what kind of income do they earn as a household unit. So for a unit of one, if there's just one household, they need to make less than $40,000 a year. If they make less than $40,000 a year and they have been impacted by COVID and they are housing instability, meaning they're behind on rent or some of their utilities, they're eligible for this program. If it's a household of two, it's less than $47,000 a year. And then if it's a household of four, it's around $60,000 a year. So if your total income is less than those amounts, then you're eligible to come in and we're going to help pay your back rent. And we're also going to give you 3 months of forward rent.
And again, I appreciate you being here. I don't know how you determine if somebody has been impacted by COVID when we've all been impacted by COVID. So I just want to talk about that, what may be a barrier for folks when you say impacted by COVID, and it's impacted everything in our lives. So just a little clarity on that. Is there some special hurdle
Sure. Your point is well made, Tony. I think a lot of people could make the case that they are experiencing a financial hardship directly or indirectly due to the COVID-19 outbreak. So this is people that have completely lost their job. Maybe they got reduced hours. They may have had a hard time finding a job in the first place. So all of those are evidence of financial hardship here as a result to COVID. It is a pretty broad topic these days and age because, as we know, there are a lot of people that have lost some form of income here as a result of this pandemic.
And again, eviction prevention. Let's talk about eviction prevention because you're getting into kind of murky waters here. 'Cause you're talking about a landlord or a property management company, and there's a part to that too. There are a lot of folks out there who their survival and their living was they had just, hey, I'm gonna, this is my retirement. I'm gonna, buy a couple, 3 homes and rent them out, lease them out, or whatever, and they're not getting money.
Yep.
So eviction prevention. What is that, and how does that work?
Sure. So first and foremost, Tony, we want to get the money into the tenant and the landlord's hand. Ultimately, the landlord gets paid. The tenant can be the avenue to get that money, or the landlord can start the process. So that's where we want to focus our energy before we actually get to an eviction process. Currently, there are bridge moratoriums in place, so there is not the ability to evict based on non-payment of rent. At some point here, the Washington State moratorium and the City of Seattle moratorium will end. Then landlords will have the ability to evict. So what we've done as part of the eviction prevention part of this program is anticipating that day will come. We've actually put a contract in place at the eviction courts with the Housing Justice Project. So if anybody in our community does start into the eviction process with their landlord, the Housing Justice Project will step in. They will provide free legal support, and at that moment, immediately offer to pay the rent. Therefore, the landlord doesn't actually have the ability to evict the household.
Mm-hmm. I'm going to ask you to say this one more again because you said immediately pay the rent.
That's
did I
right,
hear that
Tony.
correctly?
You heard that right. We have set it up so that when landlords at some point here, not right now, they don't have the ability, but they will have the ability to evict due to non-payment of rent. And we have the people at the courts that will pay people's back rent and the utilities that are in their lease to prevent that eviction from happening. Eviction due to non-payment of rent. Ideally, we want to not have people get there. We don't want our community members to experience that trauma. So we're working as hard as we can with a lot of different community partners to try to actually pay the back rent now. But if it does get to an eviction, we got a stopgap we've put in place to prevent that from happening.
You're listening to Rainier Avenue Radio.world. It's me, Tony B. This is our special impacts of the coronavirus on South Seattle and surrounding communities show that we began in March of 2020. My guest is Hedda McClendon, the director of the COVID Emergency Services Group at King County's Department of Community and Human Services. Now, I'm just going to guess that this department did not exist prior to March of 2020. So before I go further, or somehow, some way, did public health understand that we were going to be having a pandemic? And you know what? We need to set this department up. I don't. You tell me how this came to be, Hedda.
Sure, Tony. When the pandemic hit, this area has the I don't know if the undistinguished pleasure of being the first place that COVID hit in America. At the time, the Department of Community and Human Services partnered closely with public health. It was a time when all hands were on deck at King County. Right away, DCHS started building isolation and quarantine
Now,
facilities.
you know, I have to do this because all of us aren't familiar with that alphabet of acronyms. So, it's what DCSH.
Department of Community and Human Services.
Okay.
So it is the department within King County that does behavioral health. It does the Best Starts for Kids, the Vet Senior Human Service Levy, and the Mental Health and Disabilities Levy. And it does the work with vets and domestic violence. So it is, in short, it is the social services arm of King County. Most of what the department does is contract out to service providers to bring supports to the community. So when the pandemic hit, we jumped into action with public health. We partnered with them on a couple of key initiatives that were part of the COVID response. The ones that we partnered with closely, usually the role that we played is sort of the operational role, the behavioral health supports role, and public health provided the medical supports and all the guidance around COVID. So the three programs that we operate in partnership with each other are the isolation and quarantine facilities operated by King County. So that is for any community member, and they're still open right now today. If we got a community member that does not have a safe place to isolate or quarantine because they're in a multi-generational home, they got a community or a family member living with them that is at higher risk of COVID, or they don't have a home to isolate or quarantine in, we are welcoming them and we provide them with a safe place to be and all the meals and support on site until they can get through their isolation period, which means they have COVID and they need to get through the 10 days to not expose anybody else. Or quarantine, which means they don't have COVID, but they've been exposed and they might get COVID. So we still want them to separate and not put anybody else at risk in their home or in their community.
Again, had a isolation quarantine, assessment and recovery, shelter de-intensification facilities. I got more, but I got to know what that is. Shelter de-intensification facilities.
Sure.
Help me out.
Sure. Yeah. So Tony, very early in the pandemic, one of the initiatives I supported was we identified really people that experienced homelessness that were living in high-risk settings and were at high risk of COVID. At the time when we did this, it was March 2020. It was really early into this pandemic. We found shelters that served people over 65. At the time, that was one of the biggest risk factors. And what we did is we moved those folks into hotels, which now, almost a year later, we still operate a number of them. And we've learned a lot. It really led to some good lessons learned that we're now implementing and sort of taking to scale with health through housing. So that is part of one of the initiatives that I was part of standing up when we all sort of arrived, COVID had hit, and began working on this.
And how did you become director of the COVID Emergency Services Group at King County?
Sure. Tony, by the summer of 2020, we were all 6 months into the pandemic. For the Department of Community Human Services, many of us had our base job, the things we were doing before COVID hit. We had spent 6 months doing that job and working on numerous initiatives for COVID. What we decided to do as a department is create a division that really was holding the COVID initiatives, holding a lot of what were public health supports to Public Health Seattle King County, and really created this group because we knew 6 months in, we likely were going to be in this for a while and we needed a dedicated team to focus on these things. So that's when I had the pleasure of being asked to actually lead the team and lead a lot of work that the Department of Community Human Service does with Public Health Seattle King County. It has been a pleasure. It's been an honor to be in this role. A lot of our initiatives have been intentionally designed to serve communities disproportionately impacted by COVID. So I have spent a lot of time and met a lot of amazing people and partners in South King County and South Seattle over the last year and a half.
Again, this is Tony B. My guest is Hedda McClendon. Hedda, I wanted to mention those things again. Obviously, we're doing an interview and we're talking about the Eviction Prevention and Rent Assistance Program. But this is a personal question. How are you doing? How have you been over the last year and a half? How are you?
There are days when I am tired, Tony. And most days I am extremely motivated and really encouraged because I get to provide supports for our community members, whether it is a safe place to isolation quarantine, whether it is a jab in the arm. These days it is paying people's rent. I've gotten to lead unprecedented opportunities that is once in a lifetime that has risen out of a pandemic that has been devastating. So that keeps me going. Personally, I have seen firsthand loss due to the COVID pandemic. I have experienced and had the opportunity to engage with a number of staff members that were willing to raise their hand and be essential workers. I have been an essential worker this whole time. So that's been exhausting, but ultimately, every day, what motivates me is how much we are able to give back to the community. And while we haven't been able to save every life here, we sure have been able to contribute to saving a lot of lives. And especially with this rental assistance program, I'm really hoping that we can also do some work to limit the trauma people are experiencing as a result of the pandemic. So those are the things that keep me motivated. It's been a long haul here, but ultimately, it has been a pleasure to do work where I feel like I get to contribute and provide a service to the community through this.
You know, we've been doing this now again for over 18 months. And in addition to shining a lot of spotlight on the members of our communities who are doing incredible things every day that you may not hear of, I also like to take this opportunity to share with those who are working in the healthcare profession, et cetera, for the work that you're doing. And you kind of answered this question already, but what made you decide to accept this position where, again, this is dealing with a global pandemic, a lot of unknowns, impacting folks in horrific ways? Why did you say, "Yep, I'll head this effort up"? What made you take this on?
Tony, I think for a lot of people, it's really their upbringing. It is their values. It is their willingness to sort of raise a hand when a lot of people need help. And I don't think that is a role everybody is willing to take. And I totally understand that. And I appreciate that. For me, it was a call to action, and it was an opportunity. My background is in public health. I've spent a couple of decades working in homelessness and housing affordability and community development. And this, in a way, I think it was a calling in that different professions that I have worked in and am passionate about sort of all came together when I got asked to work in the pandemic. The public health, the caring for the health and safety of our community, and the opportunity to also work in housing and having a bit of experience in that. So for me, there wasn't really a question. I think it was a willingness, an opportunity to serve. And really, I feel honored that was afforded to me. I feel honored to really contribute here and, I feel honored to have the privilege of leading an amazing team. I'm working with a lot of community-based organizations that are really making it happen and getting rental assistance out into the community. And really, I'm humbled by the opportunity, Tony, for that. And that's what keeps me going.
And I don't know if you had an opportunity to hear the conversation I had previously with Dr. Magdad, but we were talking about the global impact, because a lot of times we focus on locally. When you hear, or if you've heard that about poor countries, in some instances, 2% receiving their first shot of the vaccine, and Dr. Magdad saying, this is going to impact everybody, regardless of what level of vaccination we have here in this state. If folks are 1% vaccinated in Haiti and other countries, how do you keep your head up when you know that this thing is going away, and it's there doesn't seem to be the global effort and to say, okay, this is going to impact everybody.
Yeah. How do I keep my head up? I think, Tony, I try to ground myself in my family. I try to ground myself in the good work I'm doing to contribute. You're absolutely right. If we take our American hat off and really look at the world and look at how this is really going to continue to come around until we can truly get everybody vaccinated, or enough people vaccinated that we can hit this herd immunity, we got a ways to go here. I try to enjoy some of the pleasures in the moment. I've tried to find pleasure in slowing down. I know for a lot of our community members and individuals, being at home, they feel isolated. This has been a really isolating and challenging time for folks. And I think partly for me, I've tried to enjoy those moments. And that's honestly what also sort of motivates me in the work day in and day out. But I think you're absolutely right. If you look at the bigger picture, sometimes it can be overwhelming. So when I do that and I get overwhelmed with that view, I also really try to ground myself in some of the positive things we've seen come of this. The stories of heroes, the stories of people really contributing to their community. And there are stories of many people in the medical profession, many nurses, many therapists, many teachers, where they are stepping out. They are really willing to risk their lives and continue to give back. And I try to keep myself motivated by that. And I try my best to be one of those people every day that is willing to contribute to get us through this.
We got about a minute left. We're talking about the Eviction Prevention and Rent Assistance Program. That's why we originally started this conversation. So with this final minute, I want to give you an opportunity to share with our listeners, our viewers, whatever you want to share about the Eviction Prevention and Rent Assistance Program, who they can get in touch with, how they do it.
Yeah. So I want to tell them about an upcoming event, Tony, that the White Center Community Development Association is putting on at the Skyway Resource Center. It's from 3 to 5 o'clock on October 22nd. This is where we are going to have staff at the Skyway Resource Center in person, obviously social distance and wearing a mask. And the community members can go and get some help getting into the rental assistance program and filling out this paperwork. So I want to encourage people to do that. We also got a lot of amazing partners in the YWCA, Africa Town International, and Mother Africa. They're hosting some virtual drop-in events on October 27th. It's going to be via Zoom, Tony. I'll get you the link. But I want to encourage the community. If you need help accessing this program, please go to the Skyway Resource Center on the 22nd. Please participate in the Zoom on the 28th. And if you have access to the internet and you're pretty good online, go to renthelp@kingcounty.gov and just sign yourself up.
All right, Hedda. Thanks for the work that you do, and thanks for joining us here on Rainier Avenue Radio.
Thanks, Tony. A pleasure. Appreciate it. Happy Friday.
And I'd like to thank all of you who are tuning in. Continue to tune in on our audio formats. We'll have more for you on the impacts of the coronavirus on South Seattle and surrounding communities. And remember, later on tonight, we've got exciting high school football for you. Cleveland will be taking on Roosevelt at 5 o'clock. And then at 7:45, Franklin will be taking on Lincoln. Both of these teams having surprising years, and just quite the turnaround for both of these teams. So make sure and tune in if you get the opportunity. That's it. That's all the time that I have. That's going to do it for the kid. It's me, Tony B, on behalf of Rainier Avenue Radio, saying, remember, whether you believe you can or whether you believe you can't, you are probably right. I'm out.